Hello, I'm Dr. Pamela Ruig. I hold the David J. Ellis Chair of Large Animal Clinical Sciences and Antimicrobial Resistance at Michigan State University. Welcome to our video series about antibiotic usage on dairy farms. In today's video, we're going to talk about some very practical concepts about what is an antibiotic and why are they used. Now let's start with a very simple definition. An antibiotic is a word that refers to drugs that are given to help the immune system eliminate bacterial infections. The key word here and the key concept here is the word bacterial. Antibiotics are only effective to treat bacterial infections. Thus, it's very important that we know what we're treating. In other words, have a diagnosis. Now, on dairy farms, we're fortunate that there really aren't that many bacterial infections of cows and calves. So there's really not that many reasons to use antibiotics. And indeed, on most days, on most dairy farms, antibiotics aren't being used on very many animals. Now, the most common diseases of adult dairy cows and the most common reason that antibiotics are used are for treatment or control of mastitis. The other important bacterial diseases in adult cows where antibiotics are often indicated are for metritis or uterine infections, pneumonia or respiratory infections, and a few forms of infectious disorders. In pre-weaned calves, which are also animals that are at high risk for getting sick, respiratory disease, and a few types of diarrhea, as well as naval infections, are the most common reasons that antibiotics are indicated. Now, we know how antibiotics are used because we've collected data on a number of farms in different years to look at how antibiotics are used on farms. This graph shows the antibiotic usage data on 40 dairy farms located in the upper Midwest of the US. On the vertical axis, we are using a metric called a defined daily dose. It is essentially the number of days that an average animal is receiving antibiotics, and the unit on the vertical axis is the number of defined daily doses per cow and calf per year. The thing I want to point out on this particular graph is when we look across farms, there's a lot of variation in antibiotic usage. And what this tells us is that some farms really have an opportunity to improve. And the way we improve is by making sure that we're using the antibiotics effectively and on the right cases. So to make sure we're using them on the right cases, we want to make sure we have a diagnosis, because not all antibiotics actually work on all bacteria. For example, mastitis is the most common reason that antibiotics are used in adult cows, but some bacteria that cause mastitis have very high rates of spontaneous cure. For example, if a cow has a non-severe case of clinical mastitis caused by E. coli, her immune system is often able to eliminate that infection without any use of antibiotics at all. So we need to make sure we have a diagnosis. In calves, if we've got a diarrhea caused by a viral infection, antibiotics won't be useful at all. So we need to make sure that when we use antibiotics, we're giving them to sick animals that have bacterial infections and will benefit from the use. So let's just recap the concepts today. Antibiotics are indicated for treatment of bacterial infections. Not all antibiotics work on all bacteria, and not all sick animals require antibiotics. Most importantly, because we need a diagnosis, veterinarians should be involved in every farm. We should have a diagnosis and a treatment protocol that's appropriate to ensure that antibiotic usage is being given in the most appropriate manner. Thank you.